The topic today is tibia. This is the tibia bone, which is one of the longest bone. In fact, it is the second longest bone of the body after femur, which is present as a medial bone in the leg, homologous to radius of forearm. Just like any other long bone, it consists of upper end, lower end and a shaft. For this side determination, whether it is right sided or left sided, the expanded part of the bone, the wider part of the bone should be above. It should not be like this, it should be like this, wider part above. Then prominent border or sharp border, this one which is should be anterior. The sharpest border should be the anterior, or in fact it is anterior border. It is also called as shin. And in the lower end, a hook-like projection downwards should be present along its medial aspect, and that forms the medial malleolus. So with these 3 points, the upper expanded end is above, the sharp border should be anterior, and hook-like projection should be present at the inferior end of the bone and should be present medially, which is forming the medial malleolus. Through that I can say that this belongs to right side. Now coming to the description of the upper end, let us go with the superior surface, that one, this one, the superior surface of the tibia, which we call it as tibial plateau, this one. In fact, I have drawn the same diagram here. This is a right sided superior surface of tibia. It consists of 2 condyles, this is a medial condyle and this one is a lateral condyle, and in between you see this one as the intercondylar area. This intercondylar area in the middle, you can see these 2 are the intercondylar tubercles, which makes this middle portion of the intercondylar area as a prominent one, and these 2 are the 2 condyles, tibial condyles. This is medial condyle and this one is a lateral condyle. Now coming to this medial condyle, it is concave superiorly, the superior surface is concave and lodges the medial meniscus within it. It consists of anterior surface here, this is medial surface which gives attachment to medial collateral ligaments, and this is posterior surface. In this posterior surface you can see a groove, this groove you are seeing. This groove is meant for insertion of a muscle called semimembranosus. The groove on the posterior surface of the medial condyle of the tibia receives the insertion of hamstring muscle, that is semimembranosus. Similarly, this one is a lateral condyle which consists of superior surface, anterior surface, lateral surface and posterior surface. Superior surface, lateral meniscus is lodged and it articulates with the condyle, lateral condyle of the femur, and this one articulates with the medial condyle of the femur. This one anterior surface here, it receives the attachment of iliotibial tract along the anterior surface of lateral condyle. It is iliotibial tract which is attached. To the lateral surface, it is lateral collateral ligaments, and on the posterior surface, inferiorly if you see, there is a facet here which is meant for, this facet is meant for articulation with head of the fibula. So this one is the head of the fibula to form superior tibiofibular joint. Along the posterior surface of the lateral condyle, there is an articular facet which articulates with the head of the fibula to form superior tibiofibular joint. Okay. Now coming to this intercondylar area, this region, the arrangements from anterior to posterior or the attachments from anterior to posterior in the intercondylar area are, see this one is medial meniscus, so this is anterior horn of medial meniscus, this is lateral meniscus, this is the anterior horn of lateral meniscus, this is anterior cruciate ligament, and this one is the posterior cruciate ligament. Now the arrangement of the structures in order from anterior to posterior are M, that is anterior horn of medial meniscus. This one is anterior cruciate ligament. This one is anterior horn of lateral meniscus. Then we have posterior horn of lateral meniscus. posterior horn of medial meniscus, and lastly this one is the posterior cruciate ligament. If you see the arrangement of the structures, anterior horn of medial meniscus, anterior cruciate ligament, anterior horn of lateral meniscus, posterior horn of lateral meniscus, posterior horn of medial meniscus, posterior cruciate ligament. MCL, LMC, or Medical College Lucknow, Lucknow Medical College. Like that you can remember the arrangement of the structures in the middle of the superior surface of the tibia, that means in the intercondylar region. Now coming to the shaft, if you see before that shaft, this one is tibial tuberosity, this is anterior surface, okay. This one is tibial tuberosity. It consists of smooth upper surface here. It consists of smooth upper surface and rough lower surface. To the smooth upper part, it receives the insertion of ligamentum patellae, and the rough lower part is related to subcutaneous infrapatellar bursa. Now coming to the borders, this one what you are seeing in front, which is sharp, is anterior border, which is in the lower part, it becomes continuous with the anterior margin of medial malleolus. Similarly, this is just in front of the groove for semimembranosus. If you descend downwards, that forms the medial border, which is more prominent in the middle 1/3. And similarly, this one is the lateral border. This lateral border, in its lower part, it splits into two to enclose a triangular area called fibular notch, which articulates with the fibula to form the inferior tibiofibular joint. This one is lateral border, which splits into two here to enclose a triangular notch, which we call it as fibular notch, which articulates with fibula to form the inferior tibiofibular joint. Now, with anterior border, medial border, and lateral border, there lies three surfaces. Between anterior and medial border is medial surface. Between anterior and lateral border is lateral surface. Between medial and lateral border is posterior surface. Now coming to the anterior border, it is subcutaneous, it is sharp, it is prominent, it is also called shin. Now coming to this medial surface, in its lower part, in its lower 2/3, it is subcutaneous, but in its upper part here, it receives the attachments of, if I draw this upper part of the medial surface, if I draw it here like this is upper part of the medial surface. First muscle, there is insertion of sartorius, then there is insertion of gracilis, then there is insertion of semitendinosus, and posterior to it there is attachment of tibial collateral ligament. I repeat, sartorius, gracilis, semitendinosus, and tibial collateral ligament. This sartorius is a muscle of the anterior compartment of thigh. Gracilis is a muscle of the medial compartment or adductor compartment of thigh. Semitendinosus is a muscle of the hamstring, that is the back of the thigh. But all the three are inserted at one region, and all these three muscles together we call it as guy rope muscles, which stabilizes the knee joint during movements. Okay. Rest of the medial surface is subcutaneous, and in the lower part it is related to great saphenous vein. The venipuncture of the great saphenous vein is done here in case of severe burns for catheterization, since it is superficially placed over the bone here. Now coming to this lateral surface, between anterior border and lateral border is lateral surface, which gives origin to tibialis anterior muscle. Lateral surface gives origin to, that means this one, it gives origin to tibialis anterior muscle. And coming to the posterior surface, now we are seeing at the back now. Posterior surface, there lies a prominent oblique line here like this, extending below the superior tibiofibular joint and running downwards and medially to meet the medial border, to meet with the medial border. This line we call it as soleal line. And the area above the soleal line, this one is called popliteal surface of tibia. So to the popliteal surface of the tibia, the popliteus is inserted. This is a popliteus muscle which is inserted onto popliteal surface of tibia. Now to this soleal line, it is the origin of soleus muscle. It is the fascia covering soleus muscle. It is the fascia covering popliteus muscle and the deep fascia of the leg. All these four structures are attached to the soleal line. I repeat, the soleus muscle, the fascia covering soleus, the fascia covering this popliteus and deep fascia of the leg. Now rest of this posterior surface, rest of this posterior surface is differentiated into two parts, lateral part and medial part, by thin faint vertical ridge like thing like this here, thereby dividing it into two compartments. To the medial compartment or from the medial compartment, the flexor digitorum longus muscle takes origin, and from the lateral compartment of the posterior surface, it is the origin of tibialis posterior which is taking origin. If you see the lateral surface downwards, it turns anteriorly and forms the anterior surface. You see, this is a lateral surface. It is turning anteriorly because the anterior border is shifting to the anterior margin of medial malleolus. So this becomes anterior now. So arrangement of structures from medial to lateral, here in the lower part, that is somewhere here, is first it is tibialis anterior muscle. This is tibialis anterior. Then extensor hallucis longus. Then anterior tibial artery. Then deep peroneal nerve. Then extensor digitorum longus and peroneus tertius. I repeat, tibialis anterior, extensor hallucis longus, anterior tibial artery, deep peroneal nerve, extensor hallucis longus and peroneus tertius. These are the structures which are related from medial to lateral across the dorsum of the ankle. That means in front of the lower part of the anterior surface of the tibia. I repeat, from medial to lateral, tibialis anterior, extensor hallucis longus, anterior tibial artery, deep peroneal nerve, extensor digitorum longus and peroneus tertius. Now coming to the lower part here, if you see, in the lower part it consists of lower end anterior surface which is grooved in its lower margin. This one is just grooved in its lower margin, and we have lateral surface which forms the fibular notch. We have inferior surface, this one which articulates with the superior surface of the talus, and we have posterior surface here which is grooved in its medial part, where this groove forms an area for the passage of tibialis posterior tendon. This groove is enclosed by tibialis posterior tendon. And similarly, now this medial surface which forms the medial malleolus, this region is often used for testing the edema. That means whether it is a pitting type of edema or non-pitting type, this region is often selected for testing the type of the edema. And along the anterior margin of this fibular notch is anterior tibiofibular ligament is attached. Along the posterior margin, it is posterior tibiofibular ligament. Then if you see somewhere here you find nutrient foramen. This one, this is a nutrient foramen. This is from towards the elbow I go, from the knee I flee is the direction of the nutrient foramen. The nutrient foramen is directed downwards. Hence, the growing end of the tibia is upwards. To locate the direction of the nutrient foramen, we should follow this: towards the elbow I go, from the knee I flee. That is the position of the nutrient foramen or direction of the nutrient foramen. Opposite to the direction of the nutrient foramen is the growing end of the bone. And the nutrient artery to the tibia is a branch of posterior tibial artery, and this nutrient artery is considered as the largest nutrient artery in the body. The commonest site of fracture for the tibia is midway between upper 2/3 and lower 1/3 of the shaft, where it is least vascular. It is commonly fractured here mostly in case of road traffic accidents. This is in brief about tibia. Thank you.